So I'm going to go ahead and share screen here. So I spent a few moments updating this. Every week we have new things that the team is thinking about, testing out, building. And a lot of it really does come from my conversations with you as faculty. So thank you for being a part of that. And please consider this also as an open invitation. If you have apps or ideas that you think you would really enhance learning, we're always thinking of new things to create to support educators and students. So just checking in. So for those of you, Halloween wasn't too far away. We tried to keep things light in the department. This is me in the control room. This is Marshall Lemoyne. You'll see him in a lot of videos. He was one of my alumni from many years ago. He's now a clinical specialist at Kaiser. He's been adjuncting with us for at least 8 years. And an integral part actually of the visionary team for what we build. So he showed up as Dumbledore. I showed up as a Sriracha bottle. And you know, one of the things we really tried to do, even in this very modified, challenging environment, was we made sure that students had a chance to unpack the tools that we've been teaching them. So we knew that before Thanksgiving hit, we needed to give them a chance to use their evaluation skills, to use their techniques and therapeutic exercises, their subjective exam skills, and that they would have to do cases, the most common cases. So we had 2 days, 6 hours per day, where 6 different groups were running all simultaneously. And the student was going through a full evaluation, full treatment, therapeutic exercise, patient education, and then I'm the one taking the picture. So feedback. So the student gets feedback, the entire group gets to give feedback. We always start with positive feedback. And the scale of learning and understanding cannot be replicated. So it's even in this COVID environment, we made that a top priority. Today, I've got 6 hours of cases that we're doing on Zoom. It's not going to be nearly as fun, but we knew that getting this 2 days worth in would be critical for setting the students up, right? Because they need to see the flow of when to assess and reassess and how to reflect information back to the patient. All of these little pieces that get lost in just the delivery, right? As educators, we know that the delivery of motor skills is just really the bare bones, basic part of how we create clinicians. And so this was and is a very important part of our program, letting the students play therapist, play clinician, so that we can help them, nudge them in a safe environment and help them all learn from one another. So that's always a really exciting day for us to see all of these things come together. All right, so moving into the app updates. So just as a quick overview, you can see that we've been building apps for a long time. And we've been thinking about changing the tools that faculty have and that students have access to since 2013. And well before that, I've been dreaming about it. It just took a long time to figure out, could we link and do justice to the management of low back pain and build it into an app? So you can see we got faster and faster at doing it. And before you knew it, we were building apps in a lot of different areas that we felt would really benefit from having these types of tools. So many of you, I hope, already have PhysioU, have played with some of PhysioU. And I believe next week, I have an overview of all the apps. This is just a general PhysioU, but this week is really just to give you a glimpse of what is coming up pretty soon or what we've just released.
Mike, before you get too far, Liz wrote, if you elaborate just a little bit more on where, and I think Liz, you can help clarify it if I'm not getting it right, but how the didactic and lab patient management that students have had. I think it goes back to your lab pictures.
Yeah.
And Elizabeth, you can.
I was just curious because, you know, in terms of, I think it's such a valuable experience. And my challenge is always, where do we fit that? You know, I feel like we're so squashed for time and lab space and everything. So I just didn't know, you know, when are they able to practice this beginning to end flow of practicing that
Yeah.
clinical experience. I have colleagues that say, well, that's what our integrated clinical experiences are for. They go do that in the clinic with their CIs. But I do think that it's helpful to have them experience this with the core faculty before they go to the clinic.
Yeah. So in a typical semester, we do this after we teach 2 body regions. So let's say lumbar and pelvis. Actually, we did lumbar, pelvis, hip this time. Lumbar, pelvis, hip, boom. We have to let them play all of these cases out, because by the time we finish knee, foot, and ankle, there are so many conditions that you can't do them all. So we interject these 12-hour days almost every 6 weeks or so. So we know that every time we unpack it, we give them a chance to learn from one another and for them to apply this and begin to recognize how to treat the common patterns, right? Every time we have cases, there'll always be a joint stiffness problem, a mobility deficit. There'll always be a muscle power deficit. There'll always be a motor coordination impairment, because the patterns of evaluation and treatment become repetitive. In fact, if you saw them over and over again, you'd realize, wow, one stiff joint at one body region is just another stiff joint at another body region. I know how to evaluate and treat that. And so the learning becomes additive. And that means actually their brains become more confident at being able to think at a higher level than just like, ooh, I hope I remember all the special tests of the hip, So we specifically set time aside because we almost feel this is equally or more valuable than more lecture and more lab technique teaching time. So I would say that was the first thing. We built it into the course. We almost do 3 sets of these every semester. This year is a little bit harder because of COVID, but we did one. We're doing another one right this afternoon. And usually we'll have 3 sets. Now, the way we split it up, this is a pretty big room. This lab used to house all 72 of my students when I ran labs, so I could be in there with them. We split this room into half. There was probably about maybe 12 people in this room. And we used every single room in our department because well, for one, this semester in particular is light, where only the second years are on campus. So we had free reign to spread everybody out. Almost every large classroom has a left side and a right side, or a front side and a back side. So we would typically have about 6 groups running simultaneously. And in the past, the patient would rotate. The patient and the mentor, meaning myself and the patient, would rotate from group to group. And we would run the same case again and again and again. So we could kind of see how the group did things, how they generally applied their thinking. This year, what we did was everybody stayed in one pod. She just morphed into a different patient. And we also told her to bring different types of clothes. Sometimes she wore a cap. Sometimes she put on a nice jacket, so that the students could kind of come into this new patient without it being so logically difficult to switch. So that's kind of how we did it. Any other comments about that or questions?
Michael, James again, 2 more questions real quick, and we're almost doing your little end of the session talk now, unfortunately.
No, it's good.
But we'll hurry. Michael asks if in your classes, do you, it might get, again, chime in if I'm doing it wrong, but clinical pattern approach or more diagnosis approach? And then Liz again asks, are the neurocardiopulm and other faculty doing this as well? Obviously, you lead out with the ortho side, and that's where all the genesis of PhysioU started, but you've expanded to include those. So how compliant are the other disciplines with this type of teaching and information dissemination?
So, James, the first question again
was it says working with what do you prefer in your classes, working with cases
is it
and clinical pattern
diagnosis
or more with diagnosis, right?
Yeah, so essentially Let me just take you there for a second here.
If you're going to cover it later, we can hold the question.
No, this is a good moment to do that. So
Okay.
essentially, we have chosen from our apps, because we use the apps to develop the clinical patterns for the students. So we know that during the first set of mentored evals, they are going to cover a mobility deficit, facet syndrome, a disc referred leg pain, which is a McKenzie type patient, so back pain with related leg pain, a lumbar instability. This will be a gymnast who has back pain, who extends too much. So they're going to use the concept of keeping people in neutral spine, avoiding excessive movements of the spine. So movement coordination impairment, which is really in the other guidelines, really relates to ligamentous strains, sprains, and strains. And then we'll talk about a radiating pain problem. So we'll save one of these, whether it's spinal stenosis or sciatica, for another mentored eval. But they're going to, in this case, it's a flexion sensitive, right? Flexion rotation sensitive nerve problem going down the leg. This is an extension sensitive nerve problem going down the leg. So in general, they understand the premise of how I evaluate and how I treat radiating pain patients, because that concept is going to follow them through to carpal tunnel, to cubital tunnel, to tarsal tunnel syndrome. I mean, the concepts are going to become stronger and stronger in their management strategies, as well as their evaluation strategies. They know what I'm looking for when we think that a patient has pain coming from the low back that's going down into the leg. They know that there's going to be a neuro screen. They know that they're going to assess entrapment sites in the spine and look for movements that compress or strain the nerve, and try to teach the patients to avoid those movements. So the diagnosis here, spinal stenosis, they understand the pathology, but it's tied deeply to the ICF language. And then that ICF language is then tied deeply to the clinical practice guidelines. So we don't teach any more than these main ICF categories straight from the guidelines. There's nothing more than that. If my students can actually mob someone who's stiff in his back, do repeated movements who's having referred pain because of some structure that's referring pain into the leg, if they know to do repeated movements to centralize the pain, if my students can just do guideline-based care, I am happy. I'm so pleased. And so we've cut out a lot of all kinds of different variations of back pain. And we said, let's just go follow the guidelines and stick with the most common types of problems, help them achieve success with these, and then let them go into the clinic and apply this knowledge based on these clinical patterns. So there is a tie between the pathology and the ICF category based on the clinical practice guideline.
Good.
And Jamie, the second
one comment I'll add, Michael, and it's because of being a teacher for 20 plus years, whatever, is the beauty, I think, of PhysioU is it's not just information dissemination or repository of information that students can quickly find what a special test does or what the range of motion is. It really teaches them how to process information. And Mike, you went and said that there's evaluation and management strategies, concepts, but I think what it does, it develops constructs from which they can then carry over to the other disciplines of neuro, cardiopulm, peds. It's like an auto mechanic who learns how to work on a Chevy, but then can also work on a Ford and a Toyota and
Right.
transition to other things once they get that basic stuff. So I always say ortho, I'm an ortho sports athletic trainer guy. And I always say ortho is easy. And I think that's why, we teach the construct and how to do that. And then that same thought process, and that's the beauty of PhysioU, is it teaches students how to process information, to think. That's where I think is the value of the PhysioU app, as Mike has designed it. And I applaud you for that, Mike.
Yeah.
But,
I mean, I think there's, teaching the motor skills and the techniques is one thing, but then being able to lay it out in a visual map about how these things go together is such a critical piece, because it is a stepping stone towards the application to a real patient. Now, imagine on the flip side, all the techniques have been disseminated in lab. They know how to do it technically. They've done technique 1 through 120, right, for lumbar lab or shoulder lab. And then they're left to sort out that entire mess on their own, which is why I think even before I teach them these techniques, I always walk them through the key patterns. They see and explore the app on their own, They begin to see techniques that are relevant to certain conditions. And then we basically talk about them in class. So they do it before class, they play through the patterns. I walk them through the patterns while I'm in class. And when I'm finally in lab teaching the techniques one at a time, I'm associating every technique to the patterns. So it's always sorted instead of like, I'm going to dump all this stuff on the table. You guys are going to sort it out in your integrative clinical experiences or your clinical clin ed side, right? So I think you're right in that. I think this might be Elizabeth, but you're right that many of these connections, the synthesis, should occur in the safe harbor of the classroom, where the cases are carefully thought out, they're well defined, they're simple. I really believe that in order to build complexity, you have to build simplicity. The students should be able to apply repeated movements to a patient with leg pain, see that it is successful, and see how that is different from doing some type of mobilization and traction and nerve glides for a stenosis patient. When they can see those differences in that safe harbor, man, think how much more prepared they will be to go out into the clinic, how much more useful those clinical experiences will be. So that's why we have prioritized it so much. I mean, it is a major production that we have, like, I personally cannot make that production happen. Marshall, who is super organized, who has connections to all of our alumni who are fellows and residents, all of this is pre-planned. I have a team that organizes who moves where, who's in what group, and we just rerun the play every year. And the results are really, really remarkable. That's why I think this part of it is so critical. This part of what I think helps to create orthopedic clinicians is equally important. In fact, probably more important than my lectures, equally important to the lab component, probably even more important than the lab component is this kind of progression from learning the patterns in the app, talking through the patterns with a clinical expert, which would be the instructor, and then going through lab where everything is now associated to guideline-based patterns. And then boom, you unpack it. Guys, this is a no risk, low stakes learning experience. Now we do start grading. So they have a rubric that we grade them on, but there's no points associated with it until we get later in the semesters. So towards this next second semester, we start grading them. Did you do reassessments? Yes or no? Did you look at posture at the beginning and gather an asterisk sign? Yes or no? If you don't, I'm going to start penalizing you because nothing gets a student to do something better than associating points to it. But in the beginning, I believe that students learn better when the stakes are low and they are purely there because the faculty and the mentors want to invest into them. They want to guide them. So that safe harbor concept is so critical for them to learn to kind of drive their boats, right? To man their little sailboat and try to put things together. I'm just going to keep the craziness of clinic and the variability of the patients and the chronicity issues. I'm going to hide them from it. I'm just going to make life really simple. Here's 3 pieces of wood. I need you to take this hammer and a nail, and I want you to make an A shape for me. And they have a good time doing it. And the next time I can make it more complex. So, James, there was a second part to the question. James, you're muted.
I'm sorry. That's probably the most famous term now you hear on Zoom. You're muted.
Yep.
What the other disciplines, do the neurocardiopulm guys also follow that same kind of template in terms of the organization and the clinical pattern kind of and impairment
that is
kind of mindset?
That is a great question. Let me show you how we did it with acute care and with neuro. So what we did was we used to have neuro patient days. Well, of course, that's not going to happen. So we went into the clinic and we started filming full evaluations and treatments of neuro patients and acute care patients so that the faculty could then bring these into the classroom and start developing clinical reasoning step by step. So if you notice the case studies here, COPD case study, CVA case study, LSO spine, TBI, trauma. So we basically made a hit list. What are the most common acute care cases? And so here is our CVA patient. And here is an example of that. Let me just open that for you.
Good morning, sir.
Hello.
Hi, my name's Jackie. I'll be your physical therapist today.
Morning, Jackie.
How are you feeling?
So you'll see that she's doing her introduction. She's getting her PPE stuff done. She is going to check vitals. So what we did was we broke this entire treatment session out into 6 different components, 5 different components. So here's ambulating the patient, checking balance before we ambulate. There's a lot of stuff.
Okay. Put this on. You have really good balance. Let's see if you can help me put your mask on. Keep going.
I keep going. Okay.
So we basically, as I mentioned, we are going to be building a lot of cool stuff out of this content. Some of it will be built into simulations. Some of it will be built into interactive evaluations, where we will stop video at different points, ask students to put their thoughts down on what they should check, what they should do, what kind of precautions they should be watching out for, what lines and tubes the patient might have. And then an avatar will show up after they submit their answers of Professor Jackie, who will share some of her thoughts related to those same questions. So we will essentially have multiple mechanisms for helping a student discover what are the kinds of things I do when I treat these different types of patients. We also film videos where we did a lot of things wrong. So faculty members will be able to ask students to engage. What do you see? What's problematic here? Kind of like a Where's Waldo kind of experience. So that's acute care. You can see that we're done filming all of them. We have a few more, I think, that we'd like to film, but that's part of what's coming in PhysioU Plus. I'll tell you about that in the end, because we had to build a completely new system to house this type of clinical reasoning development tools. Let me just show you here under something Mary's been doing. Mary Hudson McKinney is my colleague at APU. And we knew, let me see here. We knew that with her neuro class coming up, that we need to start filming different patients. So what we've done is we storyboarded out these are real patients, but we storyboarded out all the key things that we would want students to be able to see. So here you see a subjective exam.
So welcome. It was a pleasure having you come into the clinic. My name is Mary.
I'm very nice to meet you.
And I'm going to be your physical therapist.
So they will have different things like vitals.
So you're going to put your hands on the table. When I say ready, set, begin, you're going to take a dowel and you're going to place it in the little hole until you get all the holes filled up.
There will be things like timed up and go.
All right. So what you're going to do is
so students can actually grade this in real time. Bring out your watches or your phones. Let's grade this and determine the patient's fall risk.
All right. So what you're going to do is you're going to
So essentially we have a hit list. That's what I will show you here. Oh, actually, I'll show you here. We have a hit list of common conditions that we are continuing to gather and film so that eventually you will have a set of evaluations and treatments and reassessments of the most common types of patients. So that is where I envision how acute care and neuro, where they used to bring in patient day, they used to bring in patients, they used to set up our entire lab with hospital beds. This will be an adjunct to that. We will probably still do that once everything calms down and everybody has immunity. But until then, and even regardless of that, I think these types of learning tools can be asynchronous, can help students see the big picture, can actually be used as a preclinical assessment. So some of the simulations that we're building, I really believe we will probably use in our program as a comps. Please do these 6 orthopedic cases. Please do these 6 neuro cases. Please do these 6 acute care cases. You need to score 70 or better. It will refresh your memory about all the things that you've learned. And that is how we're going to make sure you're ready to go out and see patients. So that's another thing that I was going to talk to you about as we move forward. So I hope that's useful. We know that it's a little bit harder to mimic some of the stuff in acute care and neuro, which is why we've gone through the trouble to try to film all of this and then make it available to faculty to use. Okay, let me keep moving here. I want to give you a quick glimpse of the process that I go through with my team to figure out what to build. So we do a quick curriculum review. We decide what are the key courses that really need clinical reasoning development or really have a lot of motor skills that we could help to support faculty to teach. So prioritize classes with heavy motor skills, right? That's where video really comes in handy. Prioritization of classes that need improved evidence integration. And then the team and I will vet apps. So usually these app ideas, like I had a 2-hour meeting with the team yesterday, and we kind of vet some of these ideas with the education tech team. And then we seek out authors. So we're like, oh, I remember this particular professor. He really wanted to do this. This is his expertise. Let's reach out. And so we work with the authors to kind of storyboard the entire app, wireframe the app mockup. And then we eventually move into content development, and which is lots of times filming, editing, and writing up content. And then we push it to the programmers who will then help me create things that I want to play with. So that's the general flow. In PT, we've covered a lot of content. Maybe 60%, 70% of the big classes we have content for, but now that means we have time to think about some of the other things as well. I want to share with you the pharmacology app. So the pharmacology app has been something I've been thinking about for a while. We released it, I think, about a little under a month ago. And this is built with a pharmacist and a PT and an OT and an athletic trainer. So all of us are involved in speaking into this. And so you can look for drugs from A to Z. There are over 4,000 drugs here. Her job is to update this every 6 months. You can also go by class, drug categories. Or you can look at class adverse reactions. So here are my antidepressants. Here are the MAOIs, some of the common adverse reactions for this class. And then, of course, you can go directly to that group of medications and look at implications for rehab. So many of these drugs themselves will have adverse reactions and then implications for rehabilitation. So this can be a very powerful tool, not only for your classroom, but we are going to start building worksheets that students can use while they're in their clinicals. We're going to ask them, hey, 1 patient a week, please look at their medication list and start determining what are some of the things that you need to be aware of. What are some of the things you might need to modify? I think that's how you really integrate pharmacology into practice. So certainly you can search warfarin. That will bring up your drug, the common names, the class or category, and then adverse reactions and implications for rehab, right? So it's a very simple app. It's clean. Many of the other apps that we looked at are very, very heavy. There's just so much information there. The students don't know what to do with all of it. And so we purposely decided to clean it up. The pharmacist and I are right now working on adding kind of the nutraceutical component. And the programmers and I are discussing whether we're able to add the idea of drug interactions. So anyways, that's a quick glimpse of the pharmacology app. This is why the students subscribe to PhysioU, because we keep releasing new apps that help to bring all the different content into one easy to search place that follows them from the beginning of their program all the way through their clinicals and of course into their clinical practice. So that's the pharmacology app. Let me give you a glimpse of the exercise patterns app. This is a guideline-based app. So in our partnership with JOSPT, we are heavily invested in trying to bring the guidelines into entry-level education as well as throughout the world for educational, to improve high-level care, evidence-based, guideline-based care. So Joe Godges and I had spent a lot of time talking about, wouldn't that be cool if the key guideline-based patterns, so you'll see here, exercise patterns, you could choose a body region. Let's see, shoulder. Here's a common group of musculoskeletal patterns. So you'll see a frozen shoulder pattern, shoulder impingement pattern, shoulder instability pattern. So you can go in here and based on the pattern, let's see, subacromial pain syndrome, you'll see exercises that are, let's see, strengthening, organized, and easy for the clinician to deliver. So you can choose different exercises to drop. The difference between this and a Exercise Pro or any of those other exercise apps are that these exercises are built into quick access patterns based on the clinical practice guidelines. So no, we don't have every single condition here, but we'll have the most common guideline-based conditions, and it makes it really quick and easy for clinicians and students to deliver therapeutic exercises to the patients. The other thing that I think is quite useful, so this is just, of course, this is just a mock-up. We are probably about 2 weeks away from pushing this to the development platform where we'll beta test it. The other thing that I think is really cool is we filmed performance patterns. So there's progressions, upper extremity and lower extremity progressions. So all the ACL prevention exercises will be in here. Things related to restoring an athlete to high level care or high level performance will be here in the upper extremity progressions. Okay, so there will be different progressions. And then a cool thing that we've recently added is actually the post-op patterns. So what we did was we went and gathered the post-op protocols of some of the biggest and most well-respected hospitals and universities. And then we studied them and pulled all the similarities together and organized them in a relatively, like every PhysioU post-op protocol will be a conglomerate of the best protocols, but normalized to a very consistent format, which, as you and I know, when we teach, you grab 3 protocols from different places. The weeks are different. The phases are called something different. Different things show up in different phases. Here we have normalized it and made it simple. So if you go into post-op patterns, you'll have your most common surgeries. And from there, you will be able to look at a surgery overview. This is something you can share with your patient, or the student or the clinician will be able to read a little bit about it so they're informed when they're talking to the patient. You can click on the protocol. The beauty of the protocol is it's not just words anymore. All of these things will be linked to content in PhysioU. So eventually you'll be able to hover over any one of these techniques and a little window will show up. This is what you're supposed to do. So we're bringing the protocols to life. And you can then go into patient education. There will be a patient education piece that Joe and I have been writing up. And that is something that the students can now deliver to the patient. This is where you're at with your rehab. Congratulations, your surgery is successful. This is the plan. Don't worry. This is what we're going to do in rehab. And then you can go into each phase. So the challenge as we all know, is when you look at a protocol, it is 4 pages of black and white text. So it's very difficult to find what you need. Well, here you can just click on a phase, choose the rehab overview for that phase, look only at what you need to see. That's the beauty of these digital platforms. I can take you to whatever you need instead of having you search through page after page and trying to digest all that information. So eventually, when you click on any one of these techniques, it can take you to the assessment, the treatment, the modalities, the therapeutic exercises, all of it will be linked. So I hope I don't get to hear the collective sigh of relief. I know what a challenge it is when I'm talking about protocols. Soon PhysioU will make it very clear and very simple for you to help students understand how protocols work, and you will not have to go searching all over the place to find them. We've aggregated them all. Any comments or questions about that?
The only outstanding question we have, Mike, and I don't know if we're going to get to it, would be pediatrics, but I think you typically cover that with
Okay.
it
Yeah,
later on. So we'll
I'll
hold that.
try to, I'll
you
try
get to
to
it.
answer that. Actually, let me just take a moment to say actually, let's save that to the end. And it would be helpful to get a little bit of more definition related to that question, because I could go in all different directions with that. So let's save that to the end, James, and see if we can get a little bit more information.
Okay. Okay, Heidi, why don't you put in the chat if you have any specific
Yeah.
information you want Mike to share with you.
So the evidence-based taping app was kind of something I've been thinking about for the last couple of years. When I was in Switzerland for WCPT, I got to meet a couple of Australian professors, Dr. Maria Constantinou and Dr. Mark Brown. They had written an evidence-based taping app. And I said, man, that's exactly what we need. And so finally, 2 or 3 years later, we are pretty darn close. We met Saturday evening. They were in Brisbane, and Amber and Marshall and I met for about a couple hours. The filming's done. Let me take you through what this app will look like. You choose the app. We basically talked to a number of programs across all the different professions and said, what are the common tape jobs that you are teaching? And then we also did a literature review to look for some of the best tape jobs that we thought would fit within entry level. And we purposely left out a ton of tape jobs that people can go learn in post-professional education later. So here you will have taping principles. This is what Mark and Maria are working on right now. They've already filmed. How do you do a tape reactivity skin test? How do you tear or cut tape? How do you remove tape? We have a consent form for taping that will be downloadable, and patients and therapists can fill it out. So that's kind of what this taping principles component is. Contraindications, how do you ask these questions? Now, this is just a mock-up, so the words aren't quite right there. Cutting and tearing techniques, short videos, instructions. Here in the materials, this is also what Mark and Maria have filmed. There's the different common types of tape. So they'll talk about elastic tape, the different types of tape. Maria is actually fairly busy publishing articles on taping, and they do some continuing education, I think, around the world related to taping as well. So here's two-way stretch. They'll show different types of tape, how they stretch different, what are the properties, purported effects. And then here are your basic effects. So in their textbook, as well as in their literature review, they will have short mini TED Talks to talk about some of the common possible effects of taping. So that also will be linked to some of the evidence. Now, when you finally get to the taping part, the taping part's actually really cool. We had a lot of fun filming this. So when you choose shoulder, you can choose by condition or by purpose. So if we choose a condition and we choose instability, and we choose glenohumeral joint unloading, let's say, you can see that you have different tabs here. So in the measure tab, you'll see this is how you measure the lengths of tape that you need, right? So it's just a quick video on how to measure the tape. We also will have a tab here for materials. So it'll be a picture of cover roll, leukotape, and scissors, and then just instructions on what you need. Here's video. With the patient seated and the arm resting unloaded on a pillow. Take your pre-measured. So this is a 2-minute video. You can skip to the chase and watch the high-speed version. So again, it's up to you how the students or you want to use it to teach. And when the tape job is done, you click on 360 and you get to look at the tape job in any angle that you choose. Of course, there's a picture gallery. So that's a step-by-step. So you could literally get through the different steps in probably 30 seconds. And then we also film functional reassessment. Here's what you would do after you finish the tape job, the different things that you might choose to reassess. So here's an elbow tape job. I'm just giving you this as an example. There will also be education. This will be something you can email to the patient. Why do I have this tape? What should I watch out for? And in the case where the tape job can be done by the patient themselves or with help, we have a video embedded. So there will be instructions and a video that the caregiver can watch and apply the tape. The other cool thing we decided to try was, if this is a tape job that a patient can do to themselves, we had the patient wearing a GoPro, and you get to see a first-person view of how to apply the tape and apply the tape job. So if it's a tape job that a patient can do for themselves, they get to see it from that perspective of how you would apply it instead of from a third-party perspective. Lastly, what I don't have here that I haven't put in here is evidence. When you click on the evidence tab, you will get a rationale, some basic review of the literature of why this technique might be useful, and the citations. So that's just a glimpse of the taping app. So that's just a glimpse of the taping app. And of course, you could go via purpose. I want the shoulder region, and here's different types of tape jobs that can provide this or achieve this purpose. This app is, I would say, all the video is filmed. It is actually just the foundational principles that need to be finished. So Mark and Maria are on are driving towards the finish line, and this should be live probably end of January or the first couple of weeks of February. So we're pretty close. Again, why did we choose to do this app? Because we know that there's a lot of different tape jobs being taught in entry level. We thought it might be useful to help standardize the set and use evidence to back it up. So that's the taping app coming to you sometime in early 2021. All right. Here is the last few slides. PhysioU Plus is my vision for how we develop clinical reasoning and reasoning competencies in students, go from, to try to solve my own issues in my classroom, but I hope to also assist in solving issues in your classroom. So simulations, I have a team building PTA sims. We're working with a number of PTA faculty, Jennifer Jewell, Lori Daigle, and Sam Allen out of South Arkansas, who are driving the direction of the PTA sims. We have different faculty driving the direction of the orthopedic, acute care, and neuro sims. And you can see that we have the video content to build some pretty interesting and significant simulations that can not only be used as low stakes, low risk games for students to play, but may also eventually be used as competencies as we prepare them for the clinic, or potentially to replace some part of the clinical care that we may not be able to get students to be able to do because of availability, COVID, whatever the case. we also, so here, oh, this is just a sample of some of the games. This is a sample of Mary. I think I've shown you that. Physical agents. Again, I consider this not only as something useful in the classroom. So we have interactive course modules for all the common physical agents, but we also can use this as a way to force students to review and be prepared for when they go out into the clinic. That really ties to this idea of the clinical competency, the preclinical competency simulations and games. We're building some cool games right now. One of the faculty, the DCEs, one of the DCEs from another university said, man, our students cannot remember landmarks, normal ranges of motion, how to measure range of motion. So we decided to build a bunch of games. Those games are simple and quick games that will force students to review and remember how to do something as fundamental as range of motion, right? So I've already finished filming that. We're busy building it. And then these interactive evaluations is what I've mentioned. So you already saw samples of that.
What we're going to do
So I'm going to move forward. Sorry. Here is the timed up and go. Here's the patient. And what I was going to say is those games, I mean, not games, those interactive evaluations will be very, very powerful tools that I think you can utilize. How I'm going to utilize the orthopedic ones is throughout the semester, as I'm going through different body regions, students will be able to watch and learn from the thinking of a clinician doing an evaluation on a knee arthritis patient, on a patient with a patellar tendinopathy. So imagine they can actually interact with these short evaluations and begin to see how it all connects. The level of context you can build, the level of organization you can build in the student will forever change the way that they receive what you're trying to teach them in the classroom and what you're going to teach them in the lab. So that's just a glimpse into my mind and the future. I will have those done by June 2021. Right? Because we have all the content. Now it's just a matter of spending time building it and thinking through what is the playability mechanism. For those of you who haven't seen these different little games that we've built for the modalities, this is a refresher game. It brings the device into the student's computer. They can hover over buttons and over different parts of the device and answer questions related to the gel, or here's buttons related to the time button or the frequency button. Eventually, they will get to play short little games, case studies that will ask them to apply their knowledge. So here's your case. And they will be asked to apply their knowledge related to contraindications and precautions, make decisions about patient positioning, decisions about frequency, intensity. When something goes wrong, right, they can drag the modality and apply the modality. Okay, so this is already all done and built. The only part that isn't built that we're working on is the platform in which these kinds of games can be played. And it's a quite a involved and expensive process, but never let money get in the way of a good time. So we're building it, and we're building a lot of content to go into that. And that really leads me to this idea of that's the idea of PhysioU Plus. A lot of that is clinical reasoning development and clinical reasoning assessment related. Some new apps in the pipeline. Sometime in early January, we'll be releasing Pediatric Gait Virtual Reality. So this is a playable virtual reality game where students can analyze gait of different children with different pathology. There is a neuroanatomy explorer that we're building, which will be, it's the only way I can put it, being involved in this project is it's mind-blowing how cool this app is going to be, because you will be able to see the basics of neuroanatomy, the tracks. There will be little games embedded to help students learn the tracks. There will be different areas of the brain that get damaged, and you will get to see videos of patients performing tasks with that particular type of neurologic dysfunction, it is going to be a game changer for neuroanatomy. Here's the acute care app. The acute care app, we've almost finished filming. We have videos.
All right, so this is our Jewett hyperextension brace, just telling you you can do otherwise. You're going to have them wearing a nice shirt, a nice snug fitting shirt underneath, or the hospital gown to put onto the back. All right.
So we have videos of donning, doffing, and explanations of all the common braces you're going to see in the acute care setting. This app will have PPE, donning, doffing, and hand hygiene. It will have lines and tubes embedded into it, so all the common lines and tubes, as well as some basic case studies that faculty will be able to use in their classroom. So acute care app it's a lot of the content's done. It's just a matter of spending some time building the app. This task analysis functional movement app is a collaborative work between OT and PT, and it will cover a lot of movement analysis of the common daily tasks that we do, gross and fine motor. Medical screening, already all filmed. I'm working with Brian from Baylor, and we are going to kind of take that and make the basic medical screening skill set available and easy for faculty to teach with. And then there's a generic therapeutic exercise app that I'm working on with some colleagues that will, well, all of you who are teaching TheraX right now on Zoom know how painful it is. Soon you will have a therapeutic exercise app that will have every body region, mobility exercises, strengthening exercises, balance and proprioception exercises, very cleanly sorted out so that you could actually run an entire therapeutic exercise class. If we're back face-to-face, great. It's a reference tool that the students will use. If we're not back to face-to-face, you can run an entire Zoom class just using videos from PhysioU. So that's the therapeutic exercises app.
So this is our.
So yeah, I want to open it back up for questions. I think the first question, James, that we had, or comments, questions or comments from the group. James, you had talked about pediatrics. Maybe we
Yeah, and Heidi did chat some specific stuff, just some examination hands-on stuff, for the peds folks. And then she called a hit list of the most common diseases, torticollis. She provided examples. So
yeah,
stuff like that.
So that is on my hit list. Pediatric. Well, right now it's really hard to get in and film pediatrics. So I'm building some relationships with some of the pediatric clinics near us. And I hope that, in fact, it would be really great, Heidi, if you would reach out to me at mike@physiou.com so that we could chat a little bit further about it. I had imagined actually filming a bunch of common assessment techniques and a bunch of intervention techniques that help the patient perform, like reaching across midline or sitting upright. So I have a basic design, but I think it would be really great to be able to flesh that out further. It's on my list. I also am working on filming interventions, meaning evaluation interventions with a therapist with different types of children, just the same way we're doing neuro. I think it'd be great to have the sample that faculty can now bring into the classroom, use it as a way to create context for the students. And those same evaluations will turn into interactive evaluations, clinical reasoning development tools.
Okay, I will write to you. I will give you some.
Wonderful.
Okay.
Wonderful. Thank you, Heidi.
My comment to you, Heidi, and the rest of you guys, be careful, because next thing you know, you're going to be on the PhysioU team.
Yeah.
Helping, and it really, that's the beauty of this, is that, and Mike and all his PhysioU folks have always welcomed input. It's not that he or I or we all know more than everybody else, just that it's a collective wisdom is really what continues to develop what's going on with this program. And so we really appreciate you guys' input. So
yep.
Any other questions? Either unmute yourself or type into the chat. Probably unmute yourself and just ask it right away, right now if you like.
Feel free. Questions.
Yeah.
Other comments and questions?
Hi, I have a question.
Sure.
I was just wondering if anybody or how many people are using PhysioU to replace textbooks.
Well, that's a good question for the group, whoever is on the group. I know I have a meeting with our faculty member today, and he told me, hey, Mike, so we're not using the range of motion MMT text anymore. I have a few edits that I need you to make the techniques more precise. So we have maybe 5 or 6 videos that we need to tweak a little bit. And we are eliminating the GATE textbook because we have a GATE app. We have eliminated a special test textbook. We have eliminated the range of motion MMT textbook. I'm not sure whether our faculty have completely eliminated the assistive devices, GATE training, and transfers textbook, but really the PhysioU app has all of that covered. Because we built it for that faculty. The faculty said, hey, it's really hard for my students to read about how to do a modified 3-point gait. So could we film it all? Could we film how to get up and down the stairs with crutches? And so this entire app covers probably everything you need to teach in that fundamental skills class. I don't know if there's anybody else on the call who has considered or is actually replacing textbooks, but we've definitely started to do that in our program. And there's a number, I can't speak for others, but I know there are many others that I've talked to in other webinars who've said, man, our students are going to save so much money and have this always up-to-date resource. It's a no-brainer. So anyone else on the call who has something to contribute to that concept?
Well, we may hear input. Mike, two things real quick. One, a personal thing. When you and I went to Jacksonville for the ELC, we weren't in the vendor area for 5 minutes when a guy walked up and said, I replaced a couple, 3 textbooks in my PTA program, because what they did is that, they like the manual muscle test in one, they like the range of motion in another and stuff. So they have students buying 3 textbooks for the one class. And he goes, I replaced all 3 with this one app. The other thing is, when will the exercise patterns app be released?
Exercise Patterns, which is the guideline-based app, it is probably going to go to our beta platform in about 2 weeks. And probably around the first of the year, it will be live. It'll be live. Yeah. So that will include all the protocols and stuff.
Patricia asked that. And the last one is the other question is the simulations. When will any of the simulations be available, especially acute care? Sarah asked that.
Yeah, so we're beta testing the orthopedic simulations with a few schools right now. They're using it partly for remediation of students who are having a hard time in clinic. The acute care simulations are being storyboarded right now. I would say realistically, it won't be out till summer. So it takes a lot of time not only to build them, but to vet them. So not only do we storyboard them, then we build them, then we have faculty play them out. And so if you are interested in being part of that vetting group, please feel free to email me. I'll get you on the list. And in fact, I'd love to engage you in a conversation about some of that sim building, the sim building concept and what you guys might be looking for. So please make sure, Sarah, I think that it might be you that asked that question.
Yeah.
Me at
yeah.
you.
We would love to be a part of it.
Wonderful. Yeah, wonderful.
I wanted to just say, I'm Jeannie Stevenson, University of South Florida in Tampa.
Hi, Jeannie.
Hi. First of all, I teach the neuro rehab course here. I do use the O'Sullivan and Schmitz as the primary textbook for that course. I used to have 2 textbooks. I now just have the one. But I did use the PhysioU materials quite heavily this semester. As a matter of fact, I don't know if you remember, but I emailed you about halfway through the semester. When is the neuro rehab
app
going to be launched? And I was very happy to see when it was, because I was able to use the videos of the therapist from
MUSC,
South Carolina,
yep,
performing a very nice neuro exam on a young patient with stroke.
Yep.
And so I was able to use that. And then now I was already far enough into the course where I couldn't use as many of the, because you've got some neuro rehab techniques videos in there as well. So I'll rely more heavily upon that next year.
Yeah.
But I really liked, I was very glad because I've searched the web for several years looking for a good neuro exam video. So I actually had the students do an assignment around the neuro exam videos of this young lady.
Oh, that's fantastic.
So I found that to be very beneficial. And we also used several of the tests and measures
From the neuro
in the neuro exam earlier in the semester. Definitely relied on that.
Yeah, that's wonderful. Thank you for bringing that up. I think the neuro component is going to be very, very strong with the new neuroanatomy app. And then now you have neuro exam, and then you have neuro rehab. All of those pieces are going to come together quite nicely. And then you add on all of those evaluations. I mean, Sarah's work, that initial evaluation was the inspiration of, wow, imagine if we could have a sample evaluation and treatment and reassessment for all the common conditions. I mean, that would change the game forever. And so we are very focused on capturing. Like yesterday, I had a call with the director of rehab at Casa Colina, which is right down the street from us. They have a multidisciplinary, I mean, they're very, very well respected and well known. And some of my alumni have done residencies there. And I said, hey, I would like to partner with you so that we can capture content not only just related to acute neuro rehab, but also related to a lot of the equipment, a wheelchair fitting. So I think there is some really cool stuff that we're going to be able to explore over the next year, but I'm very excited about the neuro side. I can tell you, 7 years ago, when I finished building the first ortho app, I went to Kathy Kumagai, one of my colleagues who teaches neuro. I'm like, Kathy, this pattern thing, it works for ortho. Can we do the same thing for neuro? She's like, dude, have you ever seen a neuro patient? I'm like, no, never in my life. I mean, I've seen some, but that's not my area of specialty. She's like, the patterns are completely different. They're patient specific. You can't just say SCI is like this. And so I said, oh, well, that's kind of a damper on my party. How are we going to do this? So we started with first the neuro exam app because we knew everybody needed to teach that. That's finite, right? Yeah. And now we're at the stage where the way to help students learn how to manage and understand these different problems is one, from the neuroanatomy side, where lesions occur. Patients typically present certain ways. I think that's part of pattern development. And then the interactive evaluations will be filming the same type of patients, but now you get to see the subjective, the objective exam, the movement analysis, the choice of interventions, and then the post-treatment reassessment. I think if we can do that for the most common conditions, I mean, it's going to be quite powerful. And to be able to spread that and unify that among the programs, to standardize it a little bit, also is very important, I think, for the profession.
Yeah, I like that idea. You know, O'Sullivan has some very nice short video clips, but not what you're describing, you know, which is a follow through from, you know, the neuro exam to treatment to re-examination. Yeah. And I mean, I've been teaching in this area long enough. I've, you know, searched the web, you know, long and hard for many years, and put together some YouTube videos that I've found, but not anything with that kind of flow all the way from the beginning to the end.
Yeah.
So.
Yeah, it's going to be very exciting. I mean, the fact that we captured the first 4 patients already means I have plenty of fodder to work with and reimagine what the tool should look like. I've been spending some time in virtual reality as well. I'm not sure we need to go there yet. There's a lot of other stuff you need to pull together to make virtual reality really worth the effort and time. But rest assured, we're thinking about a lot of cool stuff. And Jeannie, anytime you have more ideas or thoughts, please send them my way. So.
I will, sure.
Yeah. Any other comments? Yes.
I'm going into a total redesign of my course for next fall. We've already had that in the planning for the past couple of years. So anyway, hopefully we won't be in this hybrid environment
Model.
next fall, but we never know. We never know.
know. Exactly.
So
Okay.
I'm sure I'll be, regardless of whether I'll be using the PhysioU next fall, regardless.
Wonderful.
So
Wonderful.
I'll
Kind
be
of
in touch.
kind of in that parallel life here, Jeannie. When I was teaching at the school, I was teaching at gait, and I'd be hunting the internet for good gait videos. Otherwise, I'd have to mimic a stroke gait pattern on the stage in front of teaching. And then every time I got a good one, the next year it's gone off the web. So what really helped me, Tom, was the gait app that PhysioU has, and it's just a phenomenal tool for me to have. And the beautiful thing for me is I can then put together a syllabus and reference a video and know it's going to be there the next year every time. So I didn't have to reinvent the wheel every year, and saved me a bunch of time. And so if you haven't, any of you folks online have explored the gait videos, they're phenomenal and really helpful in terms of education. But same thing, Jeannie, where I'd look on the web and next next year it's gone, and I'm like, oh crud, now I got to reinvent the wheel. So yeah, misery loves company, I guess.
Yeah. Good. Any other comments? Yes, thank you, Jeannie. Other comments or ideas, thoughts? Any other ideas about things that you wish you really had this past semester that would be really useful for us to film? Okay. Well, hey, if you would remember, please feel free to reach out anytime to me at mike@physiou.com. It's great. And we are actually working heavily with OT professors as well. We have a lot of different projects going on, but I hope that this actually has been useful as an update for you. To hear, we are building simulations in OT, athletic training, and PT. So just so you know that we are thinking of this in a very multidisciplinary. I'm learning a lot actually about a lot of different professions, and really excited about the potential to try to bring all the rehab professions together so that we can in fact help the patients even better. So
Mike, I got one quick comment, and I don't know, this is specific to one gentleman. Carl has had trouble with his screen. Carl, are you still having trouble with your screen? Because I sent an email that he's having trouble with his screen and couldn't see the pharmacy app, and he teaches pharm over at Marist, and didn't know if your screen is corrected. Carl, maybe Mike can run you through it real quick right now if you have time, Mike.
Yeah.
If not, there's an email that I sent to you and Carl about what is
when
it? So
you
Carl,
log in. So if you go to PhysioU.com, if you're PT, you go to PhysioU.com. If you're an OT, you go to a different place, OTU.health or PhysioU.health, sorry. So you can see that there. When you log in, I auto log in because my computer remembers me. You will see that pharmacy is towards the bottom here. So physical agents, pharmacology, PNF. So you should be able to click on it several different ways. And every single one of
anyway,
sorry, Carl, say that again.
I may not.
Sounds like there might be a connection issue with Carl, and
Yeah.
maybe that's why he was having trouble seeing the screen.
On his computer, it may very
Yeah.
well be an internet connection issue, like what we just experienced.
Right.
Carl, if you would email us at care, C-A-R-E, at PhysioU.com. If you ever have problems with your app, you can feel free to email us and we will be able to try to help you with that. Rebecca says, one idea would be to design some IPC. Oh, is that interprofessional cases for the future? Same patient where we can all, yeah, that's awesome.
Yeah, I think that would be a really cool thing to do, especially with the focus on interprofessional communication between the different programs.
You know, actually, we are exploring that right now because the whole point of reaching out to Casa Colina is me being able to have a direct line to the speech language pathologist, to the to the OT and the PT. And so a lot of the next round of filming of the neuro patients will have components of all the different professions. And I haven't quite figured that out yet. Rebecca, it'd be kind of cool to chat a little bit more about it in terms of the gameplay. For example, you can imagine a patient telling their story, and then you have these different people sitting around the table, perhaps, in this virtual augmented reality setting, where you could explore some of the things that each of those clinicians takes away from that subjective exam, or you're able to actually watch different parts of something that they might assess and choose to treat. I haven't spent that much time in thinking about the interprofessional component because a couple of my other colleagues do that. But do you have any off the top of your head thoughts? What would that look like to you?
I like the idea of starting it out. So they all get kind of that context and everything from that beginning story from the patient. But even if I teach OTA, so they don't do like the whole plan of care and everything. They could do parts of assessment, but even have like the 9-hole peg you showed with the other person.
Yep.
You know, if PT can use it, OT can use it.
Absolutely.
And then maybe even do parts of, like you had the simulation with the PT going into the hospital room, and maybe having an OT do an evaluation and then having a PT do an evaluation, or even a co-treat situation where they're both working with the same patient, focused on different things. So I don't know. I was just thinking that would be kind of cool, because then you could do it. We tried to do it this year with our PTA students where we had the same patient, but yet we had different goals for each group. And then how would you do your interventions? Let's talk about discharge planning. Let's talk about, you know, what kind of other referrals or things do you need, you know, for a safe discharge to home and that kind of stuff.
Perfect. Perfect. Yep. I will definitely bring that up to the team and we'll reimagine. I think I know that the next round of filming with the acute care patients and the neuro patients, we are going to have the OT, PT, and speech there. And then I think what we need to do is storyboard it out a little bit so that we can make sure we capture what we need and we capture the elements, right? Like you said, discharge planning would be a really cool thing to see from the different angles. Providing care and just understanding what each profession actually does, I think also is quite powerful in helping to pull the rehab net closer together. So I love it. Wonderful.
Rebecca, where do you teach? I used to teach at a university, at the Health Science University. So we had OT, PT, speech, and unfortunately, they never took great opportunity to that, you know, all those programs were at one location. And I'm curious if your university hosts all those different programs. Where do you teach?
It's actually a community college. And so we really try to do some type of IPC simulation with the nursing program. And then I do another one with the PTA program. So we would love to do one that's everybody together, but that's just so big, and we just don't have the resources to do that. But
I think if you show how interprofessional, you know, coordination and collaboration works, I mean, then with the nursing program and the PTA program, but then the PT could do that with the OT, and they could do it with the you know, other ones. But once again, it's learning the construct of how to play well with others. You know, we can do well regardless of who else we end up having in the sandbox with us. Sorry.
Right. And a lot of it's just communication and getting to know what what are the roles of each person. And it's always interesting. The nursing students are like, I had no idea what OTA did or what OT does and stuff. Right. So it's good.
You know, it dawned on me that actually the simplest way to mass produce this is to create the clinical cases with with 5 different professions in a group, right? In a breakout room, a Zoom breakout room. And the video, it's kind of like a what do you call it? A choose your own adventure game with decided pre-planned stopping points and discussion points, where then each member of the rehab team speaks in from their perspective. And it can just be this completely it's synchronous, but it doesn't have to be guided by a professor, right? Because there's only one of you. The game, so to speak, that we create has built-in stopping points and discussion points that allow for this entire experience to run on its own. And then maybe as a group, the entire group can pull out after each case, and you can have a kind of debrief. So maybe what we would do is take some of the stuff we already have, and make sure we capture OT, PT, and speech components, and be able to reveal elements. And really, because I mean, you only have so much time to do this. So it may be just one massive project for one good case, or 2 or 3 good cases that you could intersperse throughout the 3 years of a program, 2 or 3 years of a program. So it's beginning to take shape in this foggy place called my brain. So I love it. I really love it. It's a great idea, Rebecca. Other comments, ideas? Okay, so I think I've run over time. I think I want to thank you for being a part of this conversation. I hope you are as excited as I am for the different things that are coming out. We very much appreciate all your positive feedback, and know that we are constantly making changes. That's why I built it as a digital platform. So if you do see things that need to be fixed, please feel free to email me, and we can easily film in our green room to get things updated. And as new things evolve, please feel free to reach out as well. So thank you guys, everybody. Hope you guys finish off your semester strong. I've got finals this week as well. And hoping that you guys have a nice little break for vacation, and that everyone stays healthy and safe. Thank you, everybody.
Take care, Michael.
Thank you. And this video will be posted on PhysioU. It will be in the educator. So just so you know, I'm going to post this here under educator, faculty resources. I think we're going to put a link somewhere here to so that people who weren't able to come will be able to watch it. All right. Thank you, everybody, and have a great day.